Today I will be presenting a systematic review on the effects of a Mediterranean diet on children ages 4 to 8 years old with asthma. For this presentation, we will go over the introduction, the research question, methodology, results, and conclusion. Asthma is the primary diagnosis for 1/3 of the pediatric emergency department visits and one of the most frequent reasons for preventable pediatric hospitalization and school absenteeism. The total direct cost of pediatric asthma amounted to $5.92 billion in 2013, with the average annual cost per American child ranging from $3,076 to $13,612. Due to the physical and societal detriments of this chronic disease, it is important to determine what factors can help to reduce asthma attacks and/or prevent the development of the disease altogether. One continuous emerging theme from peer-reviewed scholarship suggests that an adaptation of the Mediterranean diet can lead to decreased risk of asthma. However, with the adherence to the Mediterranean diet and the amount of time that the diet should be consumed in order for reduction of asthma to take place has not been determined. Some studies suggest that a high quality of organic food consumption contributes to a lower risk of asthma symptoms. However, the studies that concluded this are not long enough to determine significant longitudinal results. Interestingly, a study that examined 975 8-year-old children found biologic evidence which supports the potential beneficial effects of the Mediterranean diet on allergy and respiratory morbidity. Furthermore, fresh fruit and vegetables are known to be rich in vitamins C, E, and B, carotene, and flavonoids, and polyphenolic compounds, which are antioxidants that may be beneficial for asthma and lung function. An intervention study that supports the link between the two examined the effect of withdrawal of antioxidant-rich foods, specifically fruits and vegetables, from the diet. Researchers within the study found an increase in airway neutrophils in adults, thus disrupting asthma control and damaging lung function. This would indicate that similar reactions may occur in children as well. Fish are also rich in N3 polyunsaturated fatty acids, and whole grains such as cereals or bread are rich in vitamin E, phenolic acids, and phytic acid that have been found to have protective effect during childhood against asthma. Being that Mediterranean diet consists of fresh fruits and vegetables and healthy fats, these results are conducive and significant to supporting the research question. Because diet is one of the most prominent environmental components which has gone through major changes, including a substantial increase in the amount of processed food consumed throughout the human population, both the rise in asthma diagnoses and processed food consumption may be associated with one another. Therefore, this review was designed to encapsulate the precise effects of consuming the Mediterranean diet in order to reduce asthmatic symptoms among children. The objective of the study is to reach a conclusion from the various data that is available to help determine whether consuming the Mediterranean diet for 6 months is an effective intervention for reducing asthma attacks among 4 to 8-year-old children. So for the methodology, we did a search and strategy, which consisted of using databases PubMed, Biomed Central, and UNE research databases to search for articles related to the research question. Each search term was separated into different categories based on population, intervention, comparison, and outcome. Search terms included children, 4 to 8-year-olds, juveniles, kids, adolescents, Mediterranean diet, low-fat diet, fruits, vegetables, whole grains and lean meat diet, whole food diet, non-Mediterranean diet, average diet, processed foods, reduced asthma attacks, little to no wheezing, little to no coughing, no asthma symptoms, and reduced asthma symptoms. The inclusion criteria consisted of children ages 4 to 8 years old, any ethnicity or race, community dwelling or free living, diagnosed with asthma or asthma-like symptoms, no acute illness, no chronic illness, or otherwise healthy, was a part of a randomized control trial, cohort study, cross-sectional study, before and after study, case control study. There were more than 10 study subjects utilized in each group of the study. Each participant was included in an intervention of the effects of the Mediterranean diet on asthma symptoms, and each article was published between 1990 to 2023. For the exclusion criteria, this consisted of studies that included only participants ranging from prenatal to 4-year-olds or any older than 12-year-olds without including ages 4 to 8 years old. Facility dwelling, acute care, or hospitalized participants were not considered. Participants who have acute or chronic illness other than asthma, not diagnosed or suggested to have asthma, less than 10 study subjects per group. Studies that focused on measurements that do not relate to the measuring of asthma symptoms or nutrients related to the Mediterranean diet, and studies that consisted of a meta-analysis or systematic review. For the data extraction, data was extracted by one researcher and entered into an overview table. The table consists of information from each study, including the reference, the study design, the funding source, quality grade, study purpose, population, intervention, outcome, and conclusion. One researcher reviewed the funding sources from each study as well and determined that there was little to no risk of bias within any of the studies included in this review. The quality rating was based on the Academy of Nutrition and Dietetics Evidence Analysis Library Quality Criteria Checklist for primary research. It was graded with a positive, neutral, or negative grade, which then helped to determine the overall quality grade that was given to the set of articles. 15 studies were evaluated to determine the research question. We started off with a search process identifying 575 articles. After screening the review of titles and abstracts, many articles were identified as duplicates. Articles that contained an abstract which was withdrawn from the database or contained unnecessary variables within the title were excluded. This resulted in 48 articles to be examined for inclusion. 33 articles were excluded from the review due to participants of the study were hospitalized or residing in acute care facility. Participants were not diagnosed with asthma. There were less than 10 individuals per study group, and the study's main focus was not on the participants' diet or asthma symptoms. 15 studies ended up meeting all the inclusion criteria and underwent data extraction and synthesis. So, breaking down the articles, we had 13 articles that utilized a questionnaire pertaining to the adherence of the Mediterranean diet. 4 articles used the International Study of Asthma and Allergies in Childhood, which is the ISAC questionnaire, to assess the participants' symptoms of asthma and their adherence to the Mediterranean diet. 8 studies used a food frequency questionnaire based on either specific foods or food groups within the Mediterranean diet. The remaining study used NHANES data to examine the adherence of the Mediterranean diet and severe asthma symptoms. 6 studies used the Mediterranean diet score to measure the overall adherence among participants to the Mediterranean diet, while 4 studies utilized the KidMed score test, which is a Mediterranean diet score test for children, and the remaining studies used tests that were categorized under other. There were various asthma outcomes that were used, which included severity of asthma based on answers within the questionnaire regarding the amount of wheezing, amount of times that medication was used, shortness of breath, amount of times that the child was sick throughout the period of the study, and blood samples. There was a common risk of bias within many of the articles, which included not adequately described methods used to assess the risk of bias. However, nine studies stated that there was possibility of bias within the method used to gather data. Food recall and intake reported by the children's parents could have been biased, and the weight and height were either not collected or reported by parents, which could have been biased as well. 6 studies did not report any incidents of bias, and 2 studies reported other incidents of bias, such as self-reported asthma outcomes and cultural and environmental differences, which may have had an effect on the diet. So for the outcomes, we categorized the different outcomes into high versus low Mediterranean diet consumption. And all the studies that were included in this review included frequency measurement of a high Mediterranean diet consumption, which consisted of 3 or more days per week, and a low Mediterranean diet consumption of 2 or less days per week. There was a positive relationship between the decreased asthma symptoms and a high Mediterranean diet consumption. One study, however, did not support high Mediterranean diet consumption as a protective factor against asthma, and another study was unable to come to a strong enough conclusion that asthma and the Mediterranean diet had a relationship. We also categorized the studies within different specific and non-specific foods. So for the non-specific foods, the Gonzalez study found that younger children, 6 to 7 years old, had a greater adherence to the Mediterranean diet, consuming more categories of foods such as meat, fruit, cereals, and potatoes throughout the week than older children, ages 13 to 14 years old. Adherence to the Mediterranean diet among the younger group was associated with less current asthma. However, a higher Mediterranean diet score was associated with an increase in probability of ever asthma. Castro-Rodriguez study used categories of pro-Mediterranean food, anti-Mediterranean food, and fast food. These groups contain food label summaries such as fruit, candy, nuts, meat, dairy, and more. After examining the results, it was determined that the Mediterranean diet may have a protective factor against current wheezing in preschool children. Dominguez study also categorized their questionnaire into the same categories as the Castro-Rodriguez study, and after examining the data, it was determined that there was an association between asthma and a high score of the Mediterranean diet. And the NANCO study discovered that children who consumed a Mediterranean diet along with their mothers throughout the 2nd and 3rd trimester had significantly lower incidence of asthma compared to the low adherence group. Researchers divided their Mediterranean diet scores into standard Mediterranean diet scores containing fruits, vegetables, fish, legumes, nuts, and cereals, a relative Mediterranean diet score, and then a pregnancy Mediterranean diet score. So for the specific food groups, the Elwood study found a negative association between starch, cereals, rice, nuts, and vegetables, and the symptoms of asthma. The results were strong enough to support exploration of further strategies to help prevent asthma conditions. The Liu study determined that the consumption of fruit drinks, non-diet soft drinks, and sweet tea were associated with current asthma, whereas Sugar sweetened beverages did not cause